Hey girl, hey, it's your birth bestie, Nurse Rini, and I'm back with this story that I haven't really heard much about, but I think it's definitely appropriate for what we talk about on my channel, which is childbirth education and pregnancy. So this article is from February 10th, 2025, and it's about a woman's feeding tube allegedly found embedded inside her stomach 35 years after surgery. Quote, they took my whole life. So let's talk about how this could happen. Let's see what this poor woman has gone through. Deborah Lowe filed a lawsuit after dealing with more than 3 decades of pain, 30 years, guys, more than 30 years, which she claims is the result of a feeding tube left inside her body. A Wisconsin woman is taking legal action after learning a feeding tube was allegedly left inside her body during surgery nearly 35 years ago. And I think this is important because, there's ageism and all kinds of isms, right? And even within healthcare and, sexism too, right? So we have a woman who's probably been complaining and she was young and she was black. So her cries and her pleas could have gone ignored for a while. And I'll talk a little bit more about those isms later, but it affects everyone. It just hits different people differently depending on who they are, what they look like, things like that. But I think a lot of women can relate to being dismissed as something being in their head or, that's anxiety and stress, and rather than maybe it's just an actual problem. So in 1989, Deborah Lowe was pregnant with twins when she underwent an emergency C-section at Mount Sinai Medical Center in Milwaukee. During the delivery, she suffered severe complications, which resulted in the death of her twins and required her to undergo a total hysterectomy at 25 years old. That's super devastating. If you're wondering how that can happen, she needs to pull her medical records. I'm sure she has, and we need to kind of see what led to this event. But let's see what else the article is saying. So Lowe was then placed on life support for 2 months, during which a feeding tube was inserted, according to court documents obtained by People. I had tubes everywhere, she recalled to Fox 6. Feeding tubes, everything on me. So what it sounds like is she had a really bad complication of pregnancy, um, and ended up in an emergency C-section. And I wonder what the emergency was. I'm thinking anywhere from like an abruption or placenta previa. I'm assuming it's something that caused a lot of bleeding, which is why they took her uterus. But that's really devastating. And honestly, guys, these things do happen, which is why I offer childbirth education classes, paid courses, but I also give a lot of free information on my channel because there's so much that goes into having a baby, so much that many women don't experience, but there are also conversely many women who do, but they just don't talk about it, understandably, because it's painful. So yeah. So things being retained in an open cavity in surgery is a real issue. It does happen. So after being discharged from the hospital, Lowe, now 60, began experiencing persistent abdominal pain. Over the following 3 decades, she saw multiple doctors and underwent a number of procedures, but her pain went undiagnosed. It was just difficult for me to do things. I like to work out. I like to walk. I couldn't do that stuff, she said. She had shortness of breath, migraines, her stomach was swelling. So this is her today. So we can see the difference between this picture and the last picture. And I wanted to point that out because this was 3 decades of her life, more than 3 decades of her life. And she has grown and she has changed. But also she experienced this discomfort and this, feeling that something was wrong. And she was right. I always tell my patients, like, you know your body better than I do. Like, I know, what I've seen in clinical experience and I know what I've learned in text. However, no one knows their body like you. And I always tell my moms that. So even if something, quote, feels off, I always tell my families, girl, just call, just call. But anyway, let's go back to this story. So it goes on to say, however, Lowe claims that during a colon procedure in April 2024, her surgeon allegedly discovered a feeding tube from her 1989 surgery embedded inside of her abdominal cavity. This news left her in shock. How could they do this? Lowe said during a press conference. Who can make this mistake? This is too much. I shouldn't have to go through this. The feeding tube was left inside for 35 years. That's my whole life, she said, bursting into tears. They took my whole life. I was only 25 years old and I couldn't have no more kids. Now I'm still going through things. I can't do things I used to do. And when she says used to do, is used to do like when she was 25, or is it even like as time has gone on, the pain has increased and gotten worse and has been more limiting? Lowe is now suing Mount Sinai Medical Center, which is now Aurora Sinai Medical Center, for claims of medical negligence, breach of fiduciary duty, and emotional distress. Court documents allege that the retained surgical feeding tube was the likely cause of her decades-long abdominal pain and gastrointestinal issues. The presence of this foreign object also contributed to extensive intra-abdominal adhesions, which required clinical intervention, extensive intervention, I'm sure. So Lowe's attorney filed a lawsuit on February 5th accusing the hospital of medical malpractice and gross negligence. He wants Lowe's to be rightfully compensated and the medical staff involved to be held accountable, demanding a trial by jury. This is going to be tough. She'll get paid for sure. They will pay her out. But what happens is when there is what's called a retained foreign object, RFO, research shows that the counts are correct. Like before you go into surgery, and again, we talk about this in my paid course. We talk about what happens in the OR and everything. They do a count to make sure that they don't leave any instruments inside of you, and they are counting throughout your procedure to make sure there's nothing left inside of you. However, sometimes there are still things left inside, even though the count is correct. And so they'll look at the documentation and they'll probably say the counts were correct. However, if it was an emergency, if it was a stat C-section, then it's highly likely that they did not do any counts of instruments, in which case they should have gotten an x-ray. But it depends on the hospital's protocol. That was 25 years ago. 35 years ago. But I cannot imagine that not being the protocol 35 years ago, but who knows? Especially sometimes people get caught up in the emergency. So if she was like a stat C-section, had major complications, ended up on a ventilator and transferred to the ICU, probably an x-ray was probably the last thing on their minds, unfortunately. They were probably just trying to get her stable and get her to the ICU so that she could, you know, not die in the OR, is likely what happened. But this is rather unfortunate. So low suffering was preventable. This case is a glaring example of the failure within the healthcare system. No patient should endure decades of pain because of preventable mistake hidden in plain sight. Aurora Sinai Medical Center did not respond to people's request for comment. The hospital said in a statement to Fox 6 that they have not been legally notified of this lawsuit and cannot comment further. During the press conference, Lamar said that this case is the most outrageous alleged negligence that I've ever seen before. I would want no one to go through this, Lowe added. It's terrible when you don't know what's going on inside of you. You just try to live day by day. So, guys, this story hasn't gotten a lot of traction, but it is indeed a very big deal. I will continue to look and follow for this case to see what comes out of it. But yeah, let me know what you think about it. Make sure you like, comment, share, and follow for more.